Hey everybody, John Schumacher here with newwavehealthcare.com, and just want to give you guys a quick heads up. If you are listening to this on iTunes, we are a video podcast, so go over to newwavehealthcare.com to get all of the video recordings from our content that we share each week. If you like video, head over there, check us out. We have over 20 videos on health and technology, health innovation, so if you're interested in those topics and prefer video content, head on over to newwavehealthcare.com. And also don't forget to subscribe to us. We have a weekly digest where we send out every Friday. We curate a list of articles that we're watching or reading each week, as well as provide the recorded interview for that week. So head on over to newwavehealthcare.com. Check us out there. So let's go ahead and get started with this interview. Today my guest is Jim Bloedau, who is a digital and mobile health expert and consultant. He has been for over 20 years in the industry. So let's just call him a smart guy when it comes to this stuff. Jim, I think it might take me about 20 minutes to list off your credentials from your LinkedIn page there. So I think I'll leave it at that, and we'll have you just start off this interview. Just tell us a little bit about you personally, your personal background, and your passions for health and technology, and then we'll jump into the conversation.
Great, John. I'm really happy to be here and help you guys out today. Yeah, my background has always been healthcare. I mean, I started working in hospitals when I was 19, and between that and I got working at a cabinet shop, that's how I got through college. But after that, I was pretty much, my background was in medical technology. That means lab sciences and some cardiopulmonary after that. And being a red hot when I first got out of school, I worked on really the first online patient monitoring system ever in the U.S. And that was in many years ago, and we were doing online patient monitoring, and that was just the beginning of digital health and healthcare. So I've been, you could call me a pioneer, and I have plenty of arrows in my back, so I can show you that. But it's always been my passion. I've always really worked on the idea of how do you use technology to sort of help us manufacture, if you will, healthcare. I mean, how do we do things? It hasn't changed. The mission has always been do more with the same. We're not going to do more with less. We usually keep the same head count, but it's just a matter of efficiency and productivity all the way up. So that still drives it here, and it really is. If you walk away from this interview as one thing, if you're not thinking about workforce multipliers and what your application does or whatever you're developing, then you're really just you're pushing the wrong rock up the hill. So it's just a sober sort of reality that you have to face it. And I don't mean to be cruel about this, but it's about money and helping healthcare run more efficiently with the same amount of money or even less in the coming years.
So when you say workplace multiplier, are you talking about efficiency, using technology to make clinicians and health providers more efficient and the system more efficient? Is that what you're talking about?
Yeah, absolutely. I mean, it's just like how you use technology in your lives today. You know, how do you compress the amount of time it takes you to do something? You've got a smartphone, you're walking around, you're staying in touch with family and friends. That's an efficiency in lifestyle. And the same thing applies to healthcare. Even though healthcare is really at the rudimentary stage of that right now, for a lot of real sensible reasons, everybody likes to say how far behind healthcare is, but and risk adverse they are. But they're very deliberate, and it's probably the most complex industry you'll ever look at. And so when you try to roll some new technology or something, the latest gadget in there, they're going to be very sober about their analysis of what you're offering them. And again, it goes back to this: how are you helping me manufacture healthcare better?
Right.
Yeah,
Okay.
Yeah.
And we'll dive into a few more specifics on the trends and kind of some of the topics that are hot today in healthcare. But let's just have you, I know you have a consulting business, is my understanding. Can you just hit us with kind of a 1 or 2 sentence statement about that and how you're personally helping health tech companies and what problems you guys are solving and those type of things?
Sure, be happy to. We're a strategic consultancy. We really help people and new companies. Actually, I've done over 16 different startups with people, worked with them, many of them, some long terms, and done over 45 different market analyses for various applications in the healthcare side. And most of that has all been on the provider side, on the doctor, the hospital, primarily the hospital side. Because it's really the provider side is where all the innovation is happening right now. There's not a whole lot happening on on the payer side. It's always been that way. Payer and the insurance companies, it's pretty much blocking and tackling, just adjudicating a claim and paying that bill, essentially. Where healthcare, when you look at on the provider side, we're sort of like a bunch of gypsies. It's a business that you deliver things while you're standing up. We're wandering around a lot. You go to a hospital and you see people moving around all the time. So we're very peripatetic is the word that you like to use, but that just means that we're on our feet, and that's where digital technology and wireless technology is really coming in to help get greater efficiencies. And a couple examples is a doctor, as he's walking from his office over to the hospital, he could be checking his patient list. He could be renewing prescriptions. He can do a number of administrative things in that little bit of time, and that may just give him that extra 10 minutes there and another 10 minutes somewhere else so he can get home and see his family at night.
Right.
Because that's a tough job being a doctor.
Not easy, definitely not. So,
yeah.
So Jim, there's some massive changes happening in healthcare, and you had in the pre-interview notes you had given me a few questions and topics to touch on. So I'm going to go down a couple of these. Maybe you can explain what they are to our viewers, and then talk about where the opportunities are for a health startup to address those issues. So
yeah.
So let's just start with federal mandates. I mean, everyone's talking about the Affordable Care Act. Can you just break down in a brief statement kind of what that is, or what effect that's having on our system as a whole, and then where the opportunities are within that?
Sure. I think, or Obamacare, some people like to call it, but the ACA, American Accountable Care Act, it is really, like some people like to say, it's like managed care in the 90s, and in many ways it is. It's basically a system that says, here's a bucket of money, and here's a bunch of people that you have to take care of, and you use all that money. And that's the way it was in managed care in the 90s. And if there's money left over, we'll share some of that savings with you. That's pretty much what the providers are looking at. If you go over that, there's some protections this time. It used to be you would have to eat the difference. And the big difference between the 90s and now is that there are what we call quality measures in the ACA. In other words, that you can deliver care that's sort of the same way in what they call a capitation.
Mm-hmm.
But you can deliver care in the same way, but you must keep the quality of care up. And so they're really looking at and using new technology to manage that quality, to survey the patient. Were you taken care of nicely, so to speak? Did the doctor look at your hemoglobin levels? These are all quality measures, and really that's probably the first thing that's happening here is this idea of an opportunity of increased visibility. So we see companies that are coming out, and just as the federal government, the CMS, Center for Medicaid, has opened up their database so you can look at data, we're seeing more and more, I think, startups that are giving this increased visibility of who's a good doctor. Are there reviews out there? The platform model, if you will. People it's sort of like Yelp for healthcare.
Yes.
Those type of applications, I think, are really great and really needed. And we're going to see that going across state lines. We're seeing that's being taken up to the level of medical tourism within the United States. You'll fly to Iowa to get a total hip because it's only $6,000 there instead of $28,000 in San Francisco or more. So I think visibility is a great opportunity there. The workforce multipliers, the time compression models, in other words, that when you start thinking about how can I compress the amount of time it takes to do something, I think you need to think about that. That would be mobile technology. So delivering care from anywhere, I think is another great example of areas that you want to go to. And it speaks to people trying to manage healthcare and do it better. It speaks to what they really want to do.
Right. Yeah, patient satisfaction obviously is a big push. I've interviewed a couple companies now that are going after that market.
Uh-huh.
And also, like you said, Yelp for healthcare hospitals. I mean, I just actually had a guy call me up the other day and showed me kind of a protocol of his startup, and it was just that. I mean, literally like readmission rates, death, mortality rates for these hospitals all listed.
Yeah.
You have a map of the whole area, and they rate them by a certain color and stuff like that. So it was
Yeah.
it's coming, and these hospitals better be aware of that, because they're going to have to change up on that, don't you think?
Yeah, and the hospitals are really kind of under. I mean, I would hate to be a CIO in a hospital right now, and because I mean, as I say, he has a ton of mandates happening right now. You have the ACO, and they're all, I mean, the ACA, but they have they're changing the whole billing system, the code system out there. The ICD-10s have switched from ICD-9s to ICD-10s. They have huge security issues that they're trying to deal with mobility and the doctor using his iPhone. So this whole idea of BYOD, security issues. I mean, it's just a very full plate for these guys. So I think when we start thinking about at the hospital level, how do we innovate there? They haven't stopped thinking about that. Their role has gotten better. So I think you have to come back to understand what's on their plate right now, and then how do you wedge your way into that? That's at the hospital level. At the physician groups, they're sort of all up in the air. A lot of consolidation. What was it? 10 years ago, 52% of the doctors were in group practices. That's down to 36%. And the difference is, the delta there is that doctors have either joined the hospital as a staff physician, or they've left the practice of medicine and gone into high tech or something else administrative, or into a consulting group. So that's an amazing shrinkage in the last 10 years.
Okay. Yeah. So boiling it down, the opportunities, you feel you've used the word workplace multiplier a lot, efficiency.
Yeah.
Making the workplace efficiency, and technology can obviously do that. That's going to be a big need, not only from a cost perspective, but a patient management perspective, because we're having all these new people coming on to the system here.
Right.
Can you talk a little bit? Let's move on to another one. A lot of people are talking about these ACOs. I mean, these accountable care organizations.
Mm-hmm.
Can you define kind of what that is, and then again, kind of hit us with kind of where the opportunities are there?
Yeah, that sort of gets back to when I was talking about the new federal regulation, the ACA market. The ACOs are a spin out of that, and that really is getting back to that. Here's a bucket of money, and here's a bunch of people, and you need to take care of them. And so the ACO can either be hospital-based or physician-based. In other words, with hospitals, it still requires a group of physicians, a group of primary care physicians, your family doctor, in other words, have gotten together, and they're going to take care of at least 5,000 lives of people out there. That's what an ACO is. So in a way, they are sort of a junior insurance company when you think about it.
Right. They're like an HMO almost, right? Like an HMO.
Almost, but they don't have the payer. They don't have that infrastructure in there. And the idea, how do you manage that bucket of money, and how do you dole that money out to your doctors? And that's the problem. So they've got their training wheels on, I think, right now. But that's what we're seeing with ACOs and hospitals is that they're starting their own insurance companies. Yeah. So people are moving toward what people like to say, the Kaiser or the VA model. But when you think about that, they think that's new, but it's really not. I think the Kaiser model is more of a public health model.
Mm-hmm. Right.
When you think about it, and public health has been around a long time, and they're doing the same thing. So everything's sort of moving that way. That's the ACA. But the other thing that's part of the ACA, which is a strategy for delivering care, is the patient-centered medical home. Mm-hmm. And that is that's really been around for a while in the pediatric side, but it's really becoming quite popular because that's more team care, and that's what we see happening more and more in the literature. In other words, that you go in and you just don't see your family physician, you're seeing the nurse practitioner or maybe a physician assistant. And even, I think, down the road, we'll have technicians that haven't even been invented yet that are really going to be delivering part of your care or health coaching or helping you navigate for how to use your computer to find the right information online. I'm on a board for a nonprofit, and that's what we do. We go out and train senior people how to use a computer because they don't even know what a mouse is.
I think it's a squeaky little thing that runs by them, huh?
Yeah, exactly. So, but it's so needed, and it's really, we're getting great results too. So.
Okay. Yeah, so the patient-centered care homes are basically, collaborative groups that are looking to improve, the continuum of care and reduce cost, improve efficiency. Is that kind of why they're being popularized by the Affordable Care Act?
Yeah, I think, well, yes, and people like it. The other thing what it does is, the Affordable Care Act has sort of shifted us around, and here's another opportunity for the developers out there, is that the idea that healthcare was always delivered as a point in time. You need a new brake, so you go in and get a brake job. In between brake jobs, there's no care. The mechanic doesn't call you up. And that's the difference that's happening right now, is this idea that we're very proactive. We're using mobile technology, monitoring equipment, Bluetooth scales that can load up your daily weight, if you're a congestive heart patient. So people can keep an eye on that, and this is in that realm of population health management. In other words, it used to be called disease management, but we're really trying to turn healthcare from the delivery of care from a point in time to more of a project management perspective. In other words, you may not be sick in between the periods of time, but we're not going to lose touch with you,
Mm-hmm.
And we're in limbo right now because that's not reimbursed. So we're seeing very aggressive areas because the federal government has said people with the readmissions problem, hospital readmissions problem, if you have they're really attacking that problem with, in the first 30 days, if you have congestive heart failure or a heart attack or pneumonia and discharge, you come back in, the hospital has to eat that difference, those costs type of thing. And that's serious money. So they're using the patient-centered modal home and mobile technology to really get dramatic results. They're cutting readmissions down by 20 to 40% in some cases. So that's real exciting. I love working in that area. That's sort of always been my area. We were doing that in my early days too.
Right. Sounds like a good model. So, what about? Can you talk a little bit about like the value-based pricing and transparency push now, and how that ties into the healthcare consumer? Because it seems like the consumer now is becoming more educated. Needs to be. The market is shifting to where there's going to be more choices now for the healthcare consumer. Can you talk about price transparencies and those type of things in the market?
Sure. I mean, I think it's just the whole idea is that the term is patient-centered these days, and that means patient-centered as a consumer, as a buyer. In the past, it's sort of whatever the doctor says we would do, and there's still a lot of that out there. I mean, we are still 90% of healthcare is still fee-for-service. In other words, somebody sends a bill in and it gets paid. We're not in the new models. That's only about 10% of it's capitated, as we like to say. So it's still relatively new. But the idea of consumer power, empowerment, the idea that we become better shoppers, maybe it's not so much in the great generation, which is the generation that's in their 70s and 80s now and 90s. Those people are not tech savvy, but the boomers that are starting to come in, fastest growing data demographics right now for adopting technology, they're going to want to, and they have time and they have disposable income, and they're moving closer and closer to these better technologies. So I think what you see is the idea that they can go online and really come up with better answers about who's a good doctor, who's got the best rate. Geez, do I really have to go in for this appointment, or can I just do a little research? I mean, those numbers of people starting to do online research whenever they have a cold or what have you, or just even a question, are really remarkable. That's really changed a lot in the last 5 years.
Right, yeah. It seems like there's some services springing up around the telemedicine model or the connect with a doctor quick from home type model. Do you feel like digital health in general will provide enough oversight for people who are ill, who are elderly, to be in their homes, to have that kind of level of care in their homes, or is that going to be an issue?
It depends. It's a matter of who the user is, who's the patient at the end. I've always said, if I'm 82 years old, I'm tired, I'm sick, and I don't want to fool with technology or learn how to use a smartphone. So who does? Who is the market out there? It's probably what some people have called the alpha daughter. If you don't have one, you hope your son married one. And I mean that with all the greatest respect in the world, but that's the person who runs care for mom and dad. And that is who you're really that's a big part of your market right now as we transition. When the boomers get there, they'll be a little more tech confident. So I think that the idea of digital technology, it just isn't between doctor and patient. It's between the care team, the patient-centered medical home, and whoever the caregivers are around that sick person. It may be the alpha daughter, it may be the spouse, it may be just a friend next door. But when we start looking at that we have these care teams, and really this, like, again, it's a project management sort of perspective that you have to take.
Yeah. I've met a couple of those alpha daughters, and I work with some elder care. I'm a physical therapist. I know a few of them. You would love to have them on your team. You would hate to be on the other side of the team there. But
I know it well. I worked 12 years in the ICU, so
you've seen a few.
I've seen a few too.
So what about the provider adoption with all of this? I mean, do you see that? I mean, are people getting on board with these changes, or where do you see that going in the next 5 years?
Well, I think most on the provider, if you say provider adoption, I mean, it's like there's the acute care hospital. And they're looking at what's going to happen inside the walls of the hospital, and that's where their focus is. And those are big healthcare systems. When we look at a lot of what's happened in healthcare, as far as innovation, is outside and really more focused on the consumer side of things. And there just hasn't been a lot of traction in that area. Nobody's making a lot of money there on the consumer side. There's a lot of great content sites, but there's only room for about 4 or 5, and the government has some great sites. But there's, who knows? There's still a lot of shakeout that has to happen on the consumer side. There's also a pivot I've seen, that's happening. People that tried on the consumer side and not gotten good traction in that area are really pivoting toward the professional side. So I think there's a huge area that hasn't been looked at, which is sort of the idea of the Aging 2.0 group. I mentor for Aging 2.0 out of San Francisco here. So that's the people who are trying to look at technology to help people age in their homes.
Gotcha.
I think that's part of it. I think the intermediate care is that after somebody leaves an acute care hospital, so that you may have in a long-term care facility or a skilled nursing facility, they're not sick enough to be in a hospital, but sick enough and not well enough to go home yet. So you put them in these other facilities. Those are going to have increased pressure up on them, and they're going to really have a lot of need for innovation. Problem is they're very small and fractionated markets. That's the problem with healthcare. I mean, healthcare is a series of very small vertical markets. So you really have to do a carve out for some of these markets to see if you can get some traction in there and think about that success. I think the other thing is that has happened is that most of the applications have been one-off applications. They just don't offer enough utility. They may only do one thing. They may perform only one test. And in the medical device area, that's sort of worked out. But in the technical side, on the smartphone side, if you will, it reminds me of the days when what they used to call PDAs, personal digital assistants, in the 90s came out. And it was the same situation, one-offs, applications, and there just wasn't enough utility. If you could stack enough utility into a smartphone or a PDA, then you're going to get some real good traction. And I think that's what Qualcomm's doing with their X Prize.
Yeah.
Where they're trying to develop the Star Trek, scanner type of situation.
Right, yeah. We just interviewed a company that was competing for that prize, and like you say, a lot of the vision is to have one device that can wirelessly connect to all these other devices and have it simplified, right? Like one device that can give you the actual input from all of the other devices that are going to be spewing data out.
Right.
In your future. Right. So what about? And it's often said that digital health is in its first generation. What are some of the standout applications that you see from this first go around?
I think that this I got to back up and say what I really like in this round, the second internet with healthcare type of situation, is the elegance of the design.
Mm-hmm.
Where just building some beautiful, functional, very intuitive, super powerful applications, and I think whoever can marry all those together is really going to be the winner, and that's a real challenge out there, I think. But again, you got to really target your market and carry it out. Is there a standout application? I'm stumbling here. I'm not thinking one that comes to right. I have things that I love. I love a live core. I love the EKG that you can get, from that. It's almost diagnostic. It's really beautiful. I love Gobiquity, where they're doing screening for children that may have lazy eye type of thing, where they can use the camera in a smartphone. I think these are great little things that can be done, but we need to put more of them together to get more gravity. I like, as I said, I'll go back and say the visibility things that I think are the best ones that have come around, the idea of price visibility.
Mm-hmm.
I think the content sites are good, but they've been around for a long time. We're sort of, and think about it, you have WebMD was Healthion back in the 90s, and now it's WebMD. That's the sort of the granddaddy of all the content sites, and they really kind of own that. But I just, I'm not going to say exactly. I think people have great ideas. I just don't know if the adoption cycle is ready for them yet.
Right. What do you see as the future? I mean, where the direction that they're all heading in?
Well, I think, the real innovation to me, I'm going to talk just at the smartphone and the digital and the mobile side of things, because it will all be mobile. I don't think anybody's not going to think about that, whether it's in a hospital, on a hospital floor, or out in the community. Everything's going to be mobile, and it's going to be very small. I think the real innovation right now is really in the software side of things. Smartphones, they're pretty much the same these days. The functionality is there. The innovation curve is sort of slowed down and starting to flatten a little bit in that area. But I think down the road, when we get into simpler and simpler and designs that people can pick up and use fairly rapidly, you start combining that with the new technology that's coming out, and these are areas that fall under the area, the lab on a chip is what's being talked about, and they're using microfluidics and proteomics. So what that is that you may have some markers in your body that four of them together don't mean anything, and you can really just sort of put a piece of body fluid like the pregnancy test. You pee on the stick and you get a plus or minus. That type of technology, but a little bit more on steroids. And then the software is going to really look at these four little markers in your body and tell whether you have the early signs of congestive heart failure. But you need really a small computer like a micro device to do that. They have devices that are as big as a smartphone that can do gene sequencing. Mm-hmm. So when we start looking at this, and this is 5 to 10 years out, but when you start seeing where it's going, that's really getting more toward the clinical side instead of consumer side. But it will be something that, who knows, you may be able to pick up a packet at the drugstore and give yourself, just like you can do hemoglobin testing today, but you can maybe do testing for precancerous issues or early signs, way ahead before you even start to have a problem that we see today. So this idea of building technology that's an early warning system is very exciting to me.
Definitely, yeah. There's a lot of that. So, what do you see the role of like genomics and your genes and being able to use personalized medicine and all that? Do you see that expanding in the future?
Oh, sure. I think it's going to get much more granular. I mean, that's just the history of healthcare. It used to be just a family doctor. Now we have family doctors and we have specialists. It gets more and more granular as we go along, and I think the idea of individualized care is going to, as the technology comes up, it will be very tailor-made. It's a good way to market and to grab part of the market. I mean, you have to think about it that way too. But I think it'll be better care for people that'll be tailored to whatever ails them at the time, and whatever their needs. And I think more so toward the wellness side. I mean, these, as I talked about, the lab on the chip technology, a lot of that is really, what I've read is early warning. I mean, you can breathe on a chip and you can see if you have lung cancer. Cleveland Clinic says they've got something like that.
Amazing.
in the lab. Yeah, just amazing stuff like that. So, it's like a breathalyzer at a bar. Geez, you go to some place in a kiosk and you blow into it and it goes like, okay, you don't have cancer. I mean, you start thinking about things like that. So that's what it'll be. And then when you get it deeper into it, I mean, it's going to be on nanotechnology when you start seeing what's very science fiction, but it'll be once we go past that phase, then we'll certainly get into the idea of nano, particles inside smart dust. They call it smart dust. These are buzzwords that you can use, and it goes. These are things that will live in your bloodstream and take care of things and seek out disease. So those are all in the lab right now. So, and the possibilities are phenomenal. And I think 10 years from now we'll see a lot of that stuff. But again, it's where's the innovation happening? It's happening in the software side right now, I think.
Okay, yeah.
Yeah, and the lab, the smart stuff.
Boy, the smart dust. That sounds scary. I mean, how easy would it be to put a microscopic little tracking GPS in your body for the government or something? It's like getting out there, but
yeah,
boy, that sounds pretty wild. So
yeah.
So you think so? The biggest opportunity right now is in software. You feel like, because that was my follow-up question, is what is the biggest opportunity that you see for an entrepreneur in the healthcare industry right now?
Well, I think any smart idea. I'm only one guy. I'm just, I'm not. I don't know everything, or I don't want to sound like I do either. But I think there's great stuff out there, and I've seen a lot of great stuff come and go before its time. Hitting the window the right way. That's what the first internet back in the late 90s was all about. The timing was all wrong for that. We're way ahead of ourselves. The technology wasn't there yet, but the visions were certainly there. What I'm seeing this round is the same visions. It's the same problems. Whether you're doing medication adherence, whether you're doing weight control, whether you're doing diabetes management, those are all the same things that we went through in the 90s with the first internet. It's just the technology has caught up to it, to the vision. So I think those visions are great, and there's always a better way to do that, and always a way to compress the amount of time it gets, and a better way to present it. So those are sort of the things that, how do you make the industry work better? The workforce multiplier idea, instead of just being lost out in the smart dust and stuff like that. That's that's great stuff, and I read about it and I love it, and then it gets me excited and makes me want to work every day. But I think help people do a better job is the first thing you have to think about, and help people live a better life too. I mean, it's there'll be more and more responsibility pushed out onto the provider, and by the time you get into your retirement days, John, it'll be, all of this stuff will be second nature to you that we've taught so far.
We'll have smart dust popping out all over us there at that point.
Right. So. I suspect you will.
Oh boy! So
helping you live longer.
Yeah, that's true. So yeah, I guess the point is solve real problems, help people work better. Just keep looking for problems to solve, right? I mean, that's the key. So
just do it better. Yeah.
Do it better. Yeah. So well, thank you, Jim, so much for your time today. It was a very insightful conversation. I hope you all enjoyed that. As we wrap things up, Jim, just tell our viewers a little bit about where they can find out more about you and your services, and then we'll say goodbye.
Yeah, sure. I'm Jim Bloedau. Again, you can get me on iag.co, and let me know. And we again work in strategic planning for companies going in healthcare or looking to extend their healthcare or demand generation. We also are recently going into the development and system integration side of things too. We're just opening up a whole new group on that area. So primarily focusing on the mobile technology and the digital health side. So if we can help anybody, please, if you have a question, just give me a call and give me just ping me and I'll get back to you quickly.
Sounds good, Jim. Well, and everybody, we'll link up all of Jim's contact information on the show notes page of this interview. So Jim, you can give me your website and any information you want, and we'll link that up for everybody to get a hold of you. All right. Well, thanks, Jim, so much for sharing your knowledge today, and hope everybody enjoyed that conversation. If you're listening to this on iTunes, as I mentioned earlier, we are a video podcast, so go over to newwavehealthcare.com to check out this interview. You can go to newwavehealthcare.com to check out all of the other interviews, but this one will be at the top of the archive page. If you're watching this on the website, go ahead and check us out on iTunes. There is a banner on the side of the website that says "Hear Us on iTunes." Go ahead and click on that to subscribe, and give us a wonderful rating and review, so you can get all of these wonderful interviews on the go at the gym or wherever you're headed. So, hope you enjoyed that. I'll see you guys next time.